All right, so starting off with having a look at clarifying female infertility. Now, of course, male fertility is, relatively speaking, a bit more simple because you've got, you know, basically one thing to deal with, and that's fixing sperm. Where with females it becomes a little bit more complicated because you've got egg quality, but you've got the structural side of things as well. You've got cervical integrity, uterine integrity, uterine lining, fallopian tube health. So it does become a little bit more complex in its dynamic. And then of course you've got the, you know, the intricate dance, which is the, you know, hormones, and getting that corrected as well. So some of the causes of female infertility can be uterine and cervical abnormalities, poorly functioning fallopian tubes, and that can be relative to what we discussed yesterday with previous history of infection and scarring and adhesions, for example. Then we have ovulatory disorders and premature ovarian failure, which we discussed a little bit yesterday. And look, getting hormones corrected, I still think remains to be one of the most tricky things when we're dealing with females, because, you know, you only have a few days each cycle in a window of time to be able to affect that part of the cycle and try and get correction happening. My general rule of thumb with ovulatory disorders, and this sort of helps, you know, validate your case for the 3 to 4 months of preconception care, is from my experience, it does take every bit of 3 full cycles at least to correct hormonal problems.